As you just saw in this video, a car ride in China between friends and then suddenly silence. One friend collapses, the other reacts instantly, performing CPR, his hands pressing rhythmically on the chest until the heartbeat returns. That one quick action separates life from death. Heart attacks strike without warning, and every second matters. If you're over 60, the truth is your risk increases dramatically. But what if no one is there to help you? What if you're alone? That's what this video will prepare you for. How to recognize the signs and survive a heart attack even when you have no one beside you. Heart disease remains the #1 killer worldwide, and according to the World Health Organization, more than 80% of heart-related deaths occur suddenly and often outside a hospital. Many victims are alone when it happens, at home, in the kitchen, while watching TV, or even lying in bed. The scariest part is that the symptoms are often dismissed as just heartburn, tiredness, or a little discomfort. But your body always tries to warn you if you know how to listen. A heart attack, medically known as myocardial infarction, happens when blood flow to a part of the heart is blocked, usually by a clot or buildup of cholesterol plaque in the coronary arteries. Without oxygen-rich blood, heart cells begin to die within minutes. This is why recognizing the early warning signs and taking action immediately can literally save your life. You don't need a doctor in those first few minutes. You need knowledge, calmness, and a plan. So, what should you look for? The classic signs include chest pressure that feels like an elephant sitting on your chest, pain spreading to your left arm, jaw, or back, shortness of breath, dizziness, nausea, and sudden cold sweat. But for seniors, especially women and diabetics, heart attack symptoms can appear differently. Sometimes it's just unexplained fatigue, mild indigestion, or discomfort in the upper back. If you ever feel off for no reason, never ignore it. Now, imagine you're home alone and you suddenly feel that tightness or pressure building up in your chest. Panic won't help, but preparation will. Your brain needs oxygen just as much as your heart does, and that's where the first crucial step comes in: staying calm and taking deliberate action. Scientists have found that anxiety increases heart rate and blood pressure, which only worsens oxygen deprivation in the heart muscle. You must do the opposite. Breathe slowly, sit down immediately, and reduce your body's oxygen demand. The goal in these first few minutes is to buy time until help arrives or your body stabilizes. In the next part, we'll uncover 7 life-saving techniques that doctors and emergency experts recommend. Methods you can do right now if a heart attack strikes and you're alone. From how to call for help smartly to a little-known breathing method that keeps blood flowing to your brain. Every second and every move counts. Because here's the truth: surviving a heart attack alone isn't luck. It's awareness, preparation, and presence of mind. And by the end of this video, you'll have the knowledge to save your own life when it matters most. Stay tuned, because what you're about to learn could protect not just your heart, but your future. When a heart attack strikes and you're alone, fear and confusion can make you freeze. But this is the exact moment when your actions decide your fate. Remember, your body is in crisis because blood is not reaching part of your heart. The faster you act, the higher your chance of survival. Let's go through 7 powerful, scientifically backed, life-saving steps that could save your life if a heart attack ever hits when you're alone. Tip 1. Recognize the warning within the first 60 seconds. The very first sign of survival begins with awareness. According to the American Heart Association, most heart attacks start slowly, with mild pain or discomfort that comes and goes. Seniors often mistake it for acid reflux, gas, or muscle pain. But here's the rule. If chest discomfort lasts more than 2 minutes or keeps coming back, treat it as a heart attack until proven otherwise. Your first step is to stop whatever you're doing. Sit down immediately to prevent a fall or injury if you faint. Loosen any tight clothing, especially around your neck and chest, to ease breathing. Avoid lying flat. Instead, sit upright with your back supported, as this position reduces the pressure on your heart and improves blood flow. Do not ignore even a mild pressure that spreads to your jaw, shoulder, or arm. Many survivors say the pain felt uncomfortable rather than severe, but it gradually intensified. The moment you feel that sense of heaviness or tightness in the chest, assume it's cardiac and take the next steps fast. Tip 2. Call for help, even if you're alone. You might think, how can I call for help if I'm alone? But your phone could be your lifeline. Keep your mobile phone close to you at all times, especially at night or when you're resting. If you suspect a heart attack, dial your emergency number, like 108 in India or 911 in the US. If you can't speak clearly due to pain or shortness of breath, you should use voice commands or emergency call features. Many smartphones actually allow you to activate SOS with your voice or by pressing the power button 5 times quickly. The call will automatically send your location to emergency services. Do not try to drive yourself to the hospital unless absolutely no other option exists. Studies show that people who attempt to drive during a heart attack have a far higher chance of collapsing behind the wheel. If help is delayed, keep the phone line open and follow instructions from the operator while performing the next survival step. Tip 3. Take a dispersible aspirin if you're not allergic. Once you've called for help, the next best action is to chew an aspirin tablet immediately, preferably a 325 milligram non-coated tablet. Why chew and not swallow? Well, chewing allows aspirin to enter your bloodstream faster through your gums, helping to thin the blood and break up the clot blocking your coronary artery. Research from the New England Journal of Medicine shows that taking aspirin at the very onset of chest pain reduces the chance of cardiac death by up to 23%. However, you should never take aspirin if you're allergic, have a bleeding disorder, or your doctor has warned against it. If you don't have aspirin, just focus on staying calm and performing controlled breathing, which we'll discuss next. But if you do, chew the tablets slowly and sit upright. Do not take multiple tablets unless advised by a healthcare professional. One is enough to help your heart regain some blood flow until help arrives. Tip 4. Use the cough CPR technique if you're fainting. This is one of the most misunderstood yet vital techniques in emergency response. Cough CPR is not a cure for heart attack, but when performed correctly during the first few seconds of cardiac arrest, it can help maintain circulation long enough for help to arrive. Here's how it works. If you begin to feel lightheaded, dizzy, or sense that you might pass out, take a deep breath and then cough hard, deep, and forceful every 2 seconds. Each cough acts like a manual pump, compressing your chest and helping push blood toward your brain and heart. This keeps your heart rhythm temporarily stable. But remember, cough CPR should only be used if you are conscious and already feeling faint. If you lose consciousness, it won't work. A study published in The Lancet explains that this technique can extend survival for patients experiencing arrhythmia-related fainting while awaiting medical aid. Tip 5. Control your breathing and stay still. One of the biggest mistakes people make during a heart attack is trying to move or call someone in panic. Movement increases your heart's demand for oxygen when it's already deprived. Instead, focus on breathing slowly and deeply. Inhale through your nose for 3 seconds, then exhale gently through your mouth for 4 seconds. This slow breathing reduces anxiety, stabilizes blood pressure, and helps oxygen circulate more efficiently. If you can, sit on the floor near a wall or in a chair so you don't injure yourself if you faint. Keep your phone in your hand and avoid unnecessary movements. Even simple actions like walking or shouting can make your condition worse. Every bit of stillness helps your heart do less work. Scientists at Harvard Medical School found that deep breathing helps stimulate the parasympathetic nervous system, which lowers heart rate and helps prevent arrhythmias during stressful events. So while you wait for help, make your breathing your medicine. Tip 6. Stay conscious and monitor your symptoms. If your chest pain eases suddenly, don't assume the danger has passed. Sometimes a brief relief in pain actually means a part of your heart muscle has stopped responding, which is even more dangerous. So stay alert to your symptoms. If you feel your pulse weakening or you start sweating heavily, position yourself safely on your side to prevent choking if you vomit or lose consciousness. If your pulse feels irregular, try to stay awake by focusing on an external object or by talking to yourself aloud. It may sound odd, but keeping your mind alert actually stimulates your brain's survival mechanisms and can delay loss of consciousness. If you're wearing any accessories like tight jewelry, belts, or wristbands, remove them to ease blood flow. And if your feet or fingers start feeling cold or numb, it could be a sign that your heart is struggling to circulate blood. So stay calm and keep your upper body slightly elevated to aid circulation. Tip 7. Prevent the next attack. Start today. The truth is, most heart attacks don't come out of nowhere. They build over years of silent damage. High cholesterol, uncontrolled blood pressure, stress, and poor diet slowly narrow your arteries until one day they block completely. Surviving one heart attack is a warning from your body. A second one could be fatal if you ignore the signs. Once you recover, it's vital to adopt a heart-protective lifestyle. Eat foods rich in magnesium, potassium, and omega-3 fatty acids, like leafy greens, avocados, nuts, and fatty fish. Avoid processed salt, refined sugars, and trans fats. And, drink plenty of water to support circulation and keep your blood viscosity low. Exercise lightly every day. Walking, stretching, or yoga for 20 minutes improves blood flow and reduces clot risk. Regular sleep and stress control are equally important. Chronic stress raises cortisol and adrenaline, which constrict blood vessels and trigger inflammation in the arteries. And perhaps the most powerful preventive tool: regular checkups. Get your blood pressure, cholesterol, and blood sugar tested every 6 months. Heart disease doesn't just happen overnight, it develops silently. Awareness is your greatest shield. Heart experts from the Mayo Clinic emphasize one golden rule: when in doubt, call it out. Even if you're not totally sure it's a heart attack, you should treat every chest pain seriously. Delaying help by even 10 minutes can mean the difference between recovery and, tragedy. Every second after the onset of a heart attack, your heart muscle loses about 1.9 million cells due to oxygen deprivation. But if you follow these 7 steps, recognize early signs, call for help, chew aspirin, control your breathing, use cough CPR when fainting, stay still, and prevent future attacks, you really do drastically increase your chances of survival. These aren't just tips, they're survival instincts, backed by science and real experience. Most seniors who survive heart attacks alone don't call themselves lucky. They call themselves prepared. They knew what to do, and honestly, that knowledge saved their life. So as you sit there today, remember this. You may not control when a heart attack comes, but you can control how ready you are when it does. And honestly, that readiness could save not only your life, but also the lives of those who look up to you. The truth about heart attacks is that they rarely come out of nowhere. Most of the time, your body whispers before it screams. A little tightness in the chest, slight fatigue after a short walk, or breathlessness when climbing stairs. All these are early signs that your heart is struggling. Yet most people over 60 ignore these warnings until it's almost too late. But imagine this. You've now learned what really happens inside your body. You've learned how to stay calm, and you know the exact steps to take. That means if the moment ever comes when your heart seizes in pain and you're alone, you'll know exactly how to fight back. Let's now understand what happens in your body in those critical minutes and how every single action you take determines your survival. When your heart attack begins, the arteries feeding your heart muscle become blocked. Within seconds, blood flow slows, oxygen drops, and the heart's rhythm begins to falter. If the brain doesn't receive oxygen for just 4 to 5 minutes, it begins to shut down. This is why staying conscious and maintaining even partial blood flow through breathing or coughing can make the difference between life and death. Most people who survive a heart attack alone share one common factor. They recognized the symptoms early and refused to panic. They acted swiftly. A calm mind is your greatest medicine in those moments. Fear tightens blood vessels, accelerates the heart rate, and worsens oxygen demand. Calmness does the opposite. It keeps your system stable, lets oxygen circulate longer, and gives your brain time to make logical decisions. Now, what happens after you've taken those immediate steps? You've chewed aspirin, called for help, stabilized your breathing, and you're waiting for emergency services. This waiting period can feel like an eternity, but it's also your most important test. If you feel your heartbeat becoming irregular, your vision blurring, or your body going cold, remind yourself that every deep breath is keeping you alive. If you feel faint, remember the cough technique, strong and rhythmic, not gentle or sporadic. Every push of air from your lungs helps pump blood upward toward your brain and heart. Keep your phone near your chest. Do not put it down far away. If you can, turn on your speakerphone so rescuers can guide you even if you can't speak clearly. Once emergency help arrives, doctors will perform an electrocardiogram and provide oxygen or medication to reopen your arteries. But here's something most people don't know. What you do in the first 5 minutes determines how well your heart recovers for the rest of your life. Those 5 minutes are the golden window. That's when self-control, awareness, and courage save lives. Let's move a step further. What happens after you survive? Many seniors think once the attack is over, life returns to normal. But surviving a heart attack is just the beginning. The recovery period is when your body heals, rebuilds, and adjusts to a new rhythm. This is the stage where most mistakes happen. Overconfidence can be dangerous. Doctors often see patients ignoring medication, skipping follow-ups, or resuming stressful routines too early. Remember, your heart needs rest before it can regain strength. In the weeks following a heart attack, your heart tissue repairs itself. The damaged area forms scar tissue that doesn't contract as efficiently as healthy muscle. That's why you must avoid emotional or physical stress during this time. Engage in slow, steady breathing exercises. Take short walks in fresh air. Avoid heavy lifting or sudden movements that increase strain. Simple actions like standing up too fast or skipping prescribed medication can trigger another episode. But here's the good news. Your heart can rebuild itself with your help. The body has a natural ability called collateral circulation, where small blood vessels expand to bypass the blocked arteries. Regular mild exercise, proper nutrition, and deep breathing help this process. It's your body's way of saying, I can heal if you let me. The next step is mental healing. A heart attack can leave lasting emotional scars, fear, anxiety, and even depression. Many seniors feel they've lost control over their health, but that's just not true. The very fact that you survived shows your resilience. This is your wake-up call to rebuild your life stronger, wiser, and calmer. Scientists from Johns Hopkins University found that patients who practice gratitude and relaxation therapy after a heart attack recover faster and have fewer recurrences. Let's talk about food, your natural shield against future attacks. The modern diet is the biggest enemy of the aging heart. Processed foods, fried snacks, and refined sugars fuel inflammation inside arteries, turning them brittle and narrow. Replace these with healing foods. Start your morning with warm water mixed with lemon. It helps thin the blood and flush out waste. Eat more foods rich in antioxidants. Berries, apples, carrots, and beets. These protect your heart cells from oxidative damage. Include garlic, turmeric, and olive oil. They help dissolve plaque buildup and improve blood vessel flexibility. One of the most powerful heart-healing ingredients is omega-3 fatty acids, found in walnuts, flax seeds, and salmon. They lower triglycerides and stabilize heart rhythm. Magnesium-rich foods like spinach, pumpkin seeds, and bananas help your heart muscles relax and prevent spasms. A diet that keeps blood thin and arteries elastic is your lifelong protection plan. Also, hydration plays a bigger role than most realize. Thick blood increases clot risk. Seniors often drink less water, which makes blood sluggish. So, make it a rule to drink a glass of water every hour while awake, especially in hot weather or after walking. Water keeps your heart's pump running smoothly. Sleep is another silent healer. During deep sleep, your heart rate and blood pressure drop naturally, giving your heart time to rest. Seniors who sleep less than 6 hours have twice the risk of another heart event compared to those who sleep 7 to 8 hours. Establish a calming bedtime routine. Avoid caffeine after 5 p.m., reduce screen time, and create a peaceful sleeping environment. Now, let's return to the most vital element of survival awareness. The modern world offers amazing tools. Smartwatches and fitness bands can monitor heart rate, blood pressure, and oxygen levels in real time. Learn to use them. Set up alerts on your phone to notify emergency contacts. If your heart rate spikes abnormally, technology can be your silent guardian. You should also share what you've learned with your loved ones. You know, many seniors suffer in silence because they don't want to worry their family. But silence can be deadly. Teach your family members how to recognize early symptoms and how to perform CPR. Knowledge spreads protection. If your children or grandchildren know what to do, they can save you or someone else. Let's imagine a moment. You're sitting alone at home, maybe reading or watching TV, when you suddenly feel pressure in your chest. Before panic sets in, your mind recalls these 7 steps. You take a deep breath. You sit upright, loosen your clothing, grab your phone, and call emergency help. You chew an aspirin, start slow breathing, and, if you feel faint, cough rhythmically. You stay conscious, alert, and in control. That calm determination gives your heart the strength to hold on until help arrives. That is how survivors are made, not by chance, but by preparation. Every heartbeat is a gift, and at your age, every day you live healthy is a victory. The human heart is remarkable. It beats about 100,000 times a day without rest. It's strong, loyal, and forgiving. But it needs your cooperation. Treat it well with good food, peace of mind, and regular movement. Avoid anger and stress. They release hormones that constrict your blood vessels. Laugh often. Listen to music that calms you. Surround yourself with positive people. Emotional well-being is medicine for your heart. Or remember, the clip you saw at the beginning of this video wasn't just a dramatic rescue. It's a symbol of hope. It shows that even when death knocks unexpectedly, courage and quick thinking can reverse it. That young man in the car saved his friend because he didn't freeze. He acted. And that's exactly what you must do if it ever happens to you. You must act, not react. Every breath, every cough, every heartbeat, you fight for matters. Now you know what to do. You know how to identify the danger, how to buy time, and how to keep your heart alive when you're alone. But most importantly, you now understand how to prevent this from ever happening again. You have the tools to protect your heart for life. So, the next time you feel even the slightest discomfort in your chest, remember, never ignore it. Your body is speaking. Listen to it, because one small decision to stay alert, to act fast, to stay calm can change everything. If you've learned something valuable from this video, please don't keep it to yourself. Share it. Someone out there, perhaps a neighbor, a friend, or a family member, might need this knowledge more than you think. Your one share could save a life. And before you go, take a moment to do this. Place your hand on your chest and feel your heartbeat. That gentle rhythm is your story of survival, your proof of strength, and your reminder that life is fragile yet powerful. Take care of it. If you found this video helpful, please like, subscribe, and share it widely. This knowledge can save lives. And maybe one day it could even save yours. Stay strong, stay calm, and stay hard.